Hi, Dr. Rudy Kachmann. Welcome to our Reversing Diabetes show. Also, obviously, preventing it. I have it every 2 weeks. It goes on YouTube, so I like to look at some of those previous shows too. I'm happy to say now that these YouTube shows, which this gets transmitted to about every 10 days, that other nations like India, Congo, is looking at these because they can't afford to the doctors and the hospitals to get rid of the diabetes. The good news is 90% of the diabetes can be reversed, yes, and I will show you very quickly, and it's not really hard to do. Many people are doing it today, but I'm sorry to say is that most medical providers across the world, but in this town and the teaching centers in these hospitals handing you a pill or a shot and not telling you how to not get it and then how to get rid of it. So the purpose of this show is to get rid of it. First, let's distinguish a little bit type 1 diabetes, type 2, because I'm speaking mainly about type 2 here. But and there's another one, gestational diabetes, but we're talking about what 90%. Type 1 is where you don't make any insulin. Type 1 diabetes where the pancreas is destroyed. It actually can be done by an autoimmune reaction. That's what you hear when there's an attack occurs in your body. It used to be more in younger people, but now it's getting a little bit older. Milk drinking can do it, yes. Also, vegetable consumption and having a reaction, celiac disease or gluten reaction can also do it. And these people invariably are losing weight tremendously. A lot of times now they have to inject themselves multiple times a day. Some now have pumps. But I also would like them to listen to this lecture because if they can help eat the right foods, they will need to take a lot less insulin. Insulin has side effects. It has side effects. And if you're type 1, you may live to be 60 or 70 because you got the shot now to keep you to drive the sugar into the cell. But if you get these pumps, I see some people eating anything they want to, and they give 100, 120, 200 units of insulin. The insulin has side effects, and you can keep it down to 10 or 20. You can live to be 100. I know of some people have done it because they watch what they're eating. They need some insulin. It keeps them alive. They have no insulin. You're not going to live very long. The type 2 diabetics, they run high blood sugars, okay? And most of the time, it's due to the acquired. It's due to the type of food that they're eating. And it's not just, this is interesting too, you say, well, if you're a type 2 diabetic, you're overweight. Well, there's about 20% of the people that are overweight that are not diabetic. Mm-hmm. So you got to run your test. Important to also run a serum insulin because the blood sugar rises late in the disease. If you get a serum insulin, when you then the insulin can be elevated and you're diabetic, and it's a lot easier to teach you what to do. And really what it's due to, even thin people can be type 2 diabetic, yes. 20-30% of the people are trophies, thin on the outside, but fat in the pancreas and in the liver. It's that determines whether you're diabetic because the fat interferes with the secretion of insulin. There's some good news there too, because there's fat in the pancreas, okay, fat in the liver, and the pancreatic cells are not making insulin, okay? You're diabetic. You don't have the insulin to push the sugar into the cells, and the blood sugar goes up. But they found out that with the fat in the liver, that in the pancreas, those pancreatic cells may just be sleeping. And sometimes even 20, 25 years later, a person gets the fat out of their pancreas and their liver. They may be overweight, they may not be overweight. But they need to get the fat out of there by eating the right diet, and the pancreatic cells wake up and secrete insulin. Now you're normal. You can be totally normal again on no medication for diabetes. Yes, it can be done. So it's important to get blood tested. And like I said, you can be a trophy, you can be thin. What a good blood test. Blood sugar. You can get 3 months worth of HbA1c. But if you get a serum insulin, it could be you're not feeling right. You can get it at a very early stage, and your insulin level is up, and you exercise a little more, get the fat out of the liver and the pancreas. Maybe you need to lose weight. Maybe you're a trophy, and you're not overweight, but there's fat in the pancreas and liver, so you need to eat right to get the fat out of there, and the pancreas wakes up and you're normal again. So don't just throw in the towel. So take a shot in a pill without checking to see what those blood tests are. Actually, insulin is what the type 1 diabetic needs, but they need to eat a correct way so they can use very little insulin, okay? So that's very important. And if you're a type 2 diabetic, now you're diagnosed, and there are easier ways and more difficult ways, but an easy way, if you're overweight and it's determined you're diabetic, I tell you, the quickest way is, I was speaking to a church group recently where they had 20 people, many women, but both men, overweight. And there's a book written by Simply Keto, and I explain what keto means, by Susan Ryan, right here. Susan Ryan, you can buy it brand new, about $35. But I was speaking to this group, and I looked on used book, and in the used ones, you can't even hardly tell from the new ones. Mm-hmm. I ordered 20 of them. Real cheap, cost me very little, and I handed to these. I treat everybody the same. What's nice about Susan Ryan's book, 60 pages, she's explaining what keto is, which I explain to you in a minute. And then the rest of the book, she has what to eat with the recipes, pictures, beautiful pictures of the right food, 3 meals a day. I sometimes suggest 2 meals a day, but you can go 3 meals a day. I mean, you can still use the book and do 2 meals a day. And there's an advantage to 2 meals because you'll get rid of your diabetes quickly, twice as fast by eating 2 meals a day, because your brain secretes hormones, growth hormones, steroids, ghrelin, the stomach hormone, that the one who stimulates the appetite, goes down in the morning. The bowel put up some CCK and different hormones. And your blood sugar in the morning is like that because of these hormones you secrete. It starts through circadian rhythm. The light comes on, and the morning is approaching. And your body secretes those. You can have some coffee, tea, water, whatever. This is what I do. I don't have diabetes, but I feel good, feel energetic. I can go, because the blood sugar is up, it's like this. And then if you eat for lunch, some guacamole, good fats, okay, some protein, some eggs, or some combination of these things, recipes. She is full of recipes. On each page, she is marked on how much fat, protein, sugar is in each recipe, yes. So you have great control. And keto is this, which you can do without fasting, but fasting speeds it up, okay? As your blood sugar drops, because you're not eating, you're fasting. Fasting goes back thousands of years. I like 16A, just like that's in this book described. If other books about that day, 16 hours you don't eat, 8 hours you eat. 2 meals would be easier in this 8-hour period, but it could be 3 if you want. And if you're eating protein, good fats, your blood sugar will go down, your insulin goes down, your fat cells open up and go to the liver, and they make ketones. Ketones are energy molecules like sugar, except they're different than sugar, much more energetic. Your brain loves them, your organs love them, the heart, the kidneys, the muscles love them, and you feel energetic. No wonder I feel so energetic that I don't eat. And I go pick a ball or walk around the pond or do both. And then because I'm playing pick-a-ball, that itself secretes hormones that make you feel good, that around noon I don't even feel like eating at all. But you got to get something in you, so I do eat. But I eat a cup of eggs. Proteins help turn the appetite off too. Not that I need it. But incidentally, protein turns off the appetite out. I'm not against eating some protein, and if you look I want you to look at websites too. YouTube, Dr. Roy Taylor is one thing. Life Without Diabetes. He wrote a book. That really describes a lot of the science if you want to do some more reading. And a Dr. David Unwin, U-N-W-I-N. They have YouTube, and his wife Jen is on there too. She goes through the psychology of eating. Good websites to look at. Dr. David Unwin, and they have literally taken Britain. They work for a socialized system, but because people are reversing and not getting diabetes, they're saving their socialized system tremendous amounts of money. And now because what he is teaching, him and his wife both were diabetics, they're the overweight type 2 diabetics, and they both now are thin, look like movie stars, and they're both going across the world spreading the word. So England is way ahead of us in terms of preventing diabetes. They're part of nutritional groups too, in a book that they wrote, Forks in the Road, has in it even websites and things you can join to give you more advice. Do you feel like you need more advice? And Susan Ryan in this keto book also has Simply Keto, also has YouTube shows. I want you to look at those. She describes their journeys, their pictures. She lost around 20 pounds and her diabetes is gone. I mean, let's face it, she looks beautiful. Doesn't she look beautiful? Okay. Her husband, the same darn thing, but you get in the book, you get the recipes, pictures of them, calorie count. Remember, I'm not about calorie restriction, especially if I'm about type of food. And she has breakfast, lunch, and dinner. I mean, what could be easier than that? So this group of 20 people I had in this church, I gave them all a free copy of this book, and I ran across one the other day, walking downtown in Fort Wayne, comes up to me and says, lost 30 pounds, my diabetes is gone, and my husband Jim, same thing. And they both had a copy. I had one for everybody. He didn't need one since she had one. But what I'm saying is, do not accept diabetes these drug companies who invented them, you take the insulin and you inject it in one of your in your body. The fat cells go like this, and you get bigger and make things worse that can be avoided. I want you to lead a life without insulin. Type 2 diabetics, 90% of them don't need insulin because the pancreas will wake up and secrete insulin again, and you'll be off the pills. In this country, people are on a lot of medications, and people don't know a lot of the side effects. And a lot of the diseases they get are reversible, and the doctor says, here's a pill, here's a shot, he's got only 10 minutes to talk to you. You must participate in your health care. Look at YouTube shows, gather information, read books, and don't just stop your medications or even consider starting them without talking to your doctor. But it would be nice if you found a doctor who feels that you can get rid of diabetes. I know a person, a well-known person in this town where 3 people have died in his family, and I went to the funeral. They all had legs amputated. Mm-hmm. And then I'm having lunch with him, trying to convince him to get rid of his diabetes. He says, Rudy, I respect diabetes. I will take the pills and shots. But he doesn't realize he's going to die younger, going to have dementia, diabetes, memory loss, dementia, Alzheimer's disease, retinal disease, blindness, thyroid disease, many cancers, lung disease, amputations, dislocations, skin diseases, over 200 diseases which can be avoided. It can be avoided. So I want you to gather information, which you can looking at Susan Ryan's YouTube shows, Dr. David Unwin and his wife Jen, and Roy Taylor. Look at their websites, their YouTube shows, maybe read their books. I like Roy Taylor. In England, they keep the statistics on health on their patients from the day they're born till the day they die. So they have 40 years of data on health of their nation. France does the same thing. And in France, they do one additional thing, which I would like to promote in our area, because we have data systems now. So we need to collect the health information from birth to death. At least let's do it in the state of Indiana, if not in the whole nation. Even our hospitals here, they are pretty collecting data systems now, but they don't connect to each other, which I think would be important because patients go to different centers, different hospitals. And in France, they have a card Vitale. That's what I'm trying to promote. Where you have a credit card, you stick it into a machine as you enter the doctor's office, and the health history of you for your lifetime is on there. That makes it so much easier. Mistakes are much less. You could go to any hospital anywhere in the state. I'd like to see it in the whole United States. That's why they voted England and France the best healthcare systems in the world. Like we came in 37th, almost near the end, and we have so much diabetes in this nation. And remember I said all people overweight are not diabetic, but a significant 80% are. Get a serum insulin. And just found out, you say, oh, my doctor said my blood sugar was normal, I'm not diabetic. I don't consider that to be the final test. If you can show me your serum insulin that's normal and you're overweight, okay, I'll go along with it. You're probably not diabetic. Good other tests would be triglycerides, which go up as your blood sugar goes up. HDL ratio is a good one. HbA1c, ALT is a liver test that tells you whether there's fat in the liver. Remember, some people are diabetic who are trophies. They're thin, but there's fat in the liver, and the ALT is elevated. Their serum insulin is elevated. Odds are that they're diabetic. Okay, so I don't want you to accept this disease. I want to know what these tests show, because the people who have the disease, especially when their serum insulins are elevated very early in life, they may feel normal. They may feel great, but diseases are occurring in their body. They found that out when the soldiers in the Vietnam, Korean War, they took all the people that died, including Koreans, Vietnamese, Americans. They autopsied them. They found a lot of Americans, although they were of normal weight, had fatty streaks in the arteries. They had the beginning of vascular disease. The Vietnamese, the Koreans, they were normal because they ate a different way. So we know that is the answer. So get these tests done. Whether there's inflammation your body makes is important too. So you get HSCRP. So get a serum insulin, blood sugar, HSCRP, ATL, triglyceride, HDL ratio, and you always hear get the cholesterol, get the cholesterol. The cholesterol is essentially irrelevant because they're selling this drug, statin drugs, that the industry is making 35 to 40 billion a year, and they don't want you to stop them. I didn't say stop yours. I didn't say to start yours, but check it out. Get a book called Cholesterol Myth. It's on Amazon. Many other toxic effect of statins by Evans and another book. But look at the PDFs or their books and gather some information. Don't start or start these drugs because I said so. I want you to gather info. And so many people are developing diabetes everywhere, but because you can go online and Google it and find out what did they feed your kids for breakfast. I look at it. Cinnamon buns, Pop-Tarts, fruit juice, milk. These all are foods. If you want to make children addicts, sugar addicts, that's what you would feed them. Milk companies, processed food companies have bribed their congressmen, so they're feeding your kids pancakes, cinnamon buns, I see it on there, making addicts out of them. That's why when you look around, you see many overweight people. 80% are diabetics. This is not a judgment-free zone, but you get a pot belly, odds are you're diabetic. But get a serum insulin, blood sugar, HbA1c to be certain. I'm not saying that you have it for certain, but the odds are pretty high. And the good news is that if you follow the advice of eating different type of food, eating good fats, guacamole, olives, make a list what good fats are, and fruit. Actually, there are fruits that have less sugar in them than others, but fruit is really a sugary food. People don't realize that. But to eat low sugar fruits, ones that have seeds in them are a little more healthy. Green grapes are a little more healthy. But if you get a problem and don't know for certain, you might cut back on that for a little while. And I think fasting 16-8, if you said, well, I got type 2 diabetes, and if you do fasting 16-8, you probably could get rid of your diabetes in 3 weeks that quickly, yeah, especially if you're doing the fasting. It's like that, and the cost can be tremendous. The complications of diabetes and amputations and dislocations and blindness. Most of Alzheimer's disease is a sugar disease. Yes, yes. So and to go online and look at Susan Ryan, and sugar makes us feel good, so it affects our brain. So Keto Karma is part of her shows, and Roy Taylor's work. And here's a very famous person, Dr. Jason Fung, F-E-N-G, the diabetes code, the obesity code. He has 3-4 books, and kidney disease is a huge complication of diabetes. Most people go into dialysis for kidney disease. Could have avoided that altogether if they've been running the right test on them, GFR, glomerular filtration rate. When they had no symptoms, they could be kept away from dialysis, but these dialysis centers are not promoting, preventing, stopping, reversing diabetes. And the kidneys are very resilient. I took a patient which had a GFR of 5, who was all on dialysis. She didn't want to get dialyzed. I taught her this way, and guess what? Her GFR rose up again. Dr. Unwin proved it, that you can actually reverse GFR, which everybody thought you couldn't do that. Yes. So watch the other shows, read some books, look at these websites, and maybe somehow you can avoid your child eating the food in the school system. There are ways to buy foods cheaper, for example, but I've been attempting to speak to the head of the school board, but that was 6 weeks ago. It's probably never going to happen. But I'm trying. I do this because I care about you. I don't want you to die young or to be disabled. I know the way. I know how to teach it. So join my army. And I've declared war on diabetes. That's in some of my other books. But thank you for listening. Why am I doing this? Because I care about you. I'm a doctor. I love you, and I want you to play pickleball or tap dance with me when I'm 100. I wish you good luck. Thanks so much. And I do this about every 2 weeks. And this information is spreading to other countries because they can't afford to take care of these patients. And they take this information off YouTube. And I really thank the library for allowing us to give these, do these TV shows, radio shows here, and then it goes to YouTube, it spreads across the world. So these libraries, I'm so thankful. I think the spirit of the universe may have created them, but I'm taking full advantage of it. I love you. Thanks so much. And there's something you'd like to tell me, I hope you send me a note or an email or stop me in the hallway. Bye-bye. Thanks.